a massive study done out of UCLA medical school hospital system. They monitored, they rather tracked everyone coming in with a heart attack. They plotted where their LDL levels were. And it was a total bell curve. And the most common number, the peak of the bell curve distribution was normal. And they found that more people had come with a heart attack who had LDL levels that were good, ideal, than had problematic LDL numbers. So LDL had no predictive power whatsoever. So LDL itself comes on a spectrum. And this could be why it matters, and it could explain some of the conflicting evidence where some people say LDL matters, others say it doesn't. It may be because LDL has such a variety to it, specifically its size and density. And the smaller, more dense LDL appears to be more atherogenic than the larger, more buoyant LDL molecules, which appears to have, again, no problem with regards to heart disease. But most people don't measure their LDL diameter and density. But that's where, once again, the triglyceride to HDL ratio is, in fact, a surrogate marker, not only of insulin resistance, but also LDL density. That if someone has a higher triglyceride to HDL ratio, that heavily, heavily correlates with a more smaller, dense LDL, which is more atherogenic. And it's no surprise, knowing that it should be the triglyceride to HDL ratio that is used as the determinant for prescribing someone statins. What we found was that if someone had a higher triglyceride to HDL ratio, there did appear to be a mortality benefit and a lower risk of heart disease. Now, I say that very, very cautiously, because rather than someone taking a statin, I would much prefer that they improve their triglyceride to HDL ratio and thus their LDL diameter, by changing their diet, which can be very, very readily done within weeks. Someone can take a very dense LDL phenotype within their body and expand it into the very mild, benign, and even healthy larger LDL. But just to defend LDL, especially in women, the lower the LDL gets, the higher and higher the risk of Alzheimer's disease, the higher the risk of blood-based cancers like leukemias, and the higher the risk of serious infections. And it's not subtle either. It's like a 15 times greater risk as LDL goes lower and lower. LDL is protective of the body. It is essential. And by waging war on it, it's no surprise that there really are disastrous consequences